Hello, I'm Kathy Grace with the Graduate Center for the Study of Early Learning, and today, as part of our conversation series, we're so happy to have Patti Parker with us. She is president of United Way of Northeast Mississippi. And Patti, thanks for joining in with us and having a conversation. I'm very appreciative of your time.
Thank you, Dr. Grace. I'm just glad to be here.
Well, if you would just explain a little bit about the United Way network, if you would, in the state and the overall mission of the United Way.
Absolutely. Well, United Ways across the country are each separate and independent and autonomous and work in our communities. The United Ways in Mississippi, there are 17 organizations across the state. Again, all separate, autonomous, local boards and local decisions being made, but we work in very similar ways in our communities. Here in Northeast Mississippi, we cover 8 counties, and our mission is to create opportunities to improve people's lives in each of the communities we serve. We try to do that by being a catalyst for philanthropic growth and impact in Northeast Mississippi. We provide funding to about 60 programs across our 8 counties that work under 3 impact areas that are academic success, family stability, and health and wellness.
Well, I know in the early childhood world, the United Way has been supportive, but not necessarily as upfront with their support, given what we're going to talk about today. And so if you would explain to folks that are listening, when I say the ALICE report, that may be confusing to some folks. So if you would just start off with, what does ALICE mean, and what was the decision behind having this report done, and just tell us about it.
Yeah, well, ALICE stands for Asset Limited, Income Constrained, Employed. And this is a segment of our population that might have been previously referred to as the working poor. Our United Ways across Mississippi had been following pretty closely the publication of what is called state ALICE reports from other states across the country, following those. And we were interested in how a report such as this could kind of be used to highlight the scope of needs in Mississippi, what sort of the depth and the breadth of issues, and then armed with data generated by this report, how can we create and convene and advocate for changes to address the needs of ALICE households. The research for this is done by United for ALICE, and it generates a tremendous amount of data for each state, and Mississippi is no exception. They have a methodology overview and rationale that lays out how their data is collected and the parameters of how the data is analyzed. One of the prime directives in undertaking that has to do with addressing the shortcomings that are well known of federal poverty level guidelines, and looking at how they can provide sort of a new baseline that incorporates and accounts for how families live today, our modern living patterns, real world expenses, and especially the technological needs of today's family. The data comes from official, publicly available sources that ensure everything is transparent, the data is transparent and replicable. And regarding the needs of childcare, that is one of the main areas where the ALICE report shines, because it takes a look at how ALICE families struggle to be able to pay for quality childcare. And in looking at ALICE households across the state of Mississippi, what we found is that 19% of households in Mississippi are at federal poverty level guidelines. We can say 19% of those households are in poverty. Another 31% are what we'll term as our ALICE households. These are families who are working but do not have the means to meet even a survival household budget. And so you're looking at 50% of Mississippi households who are unable to support or afford the most basic household budget. And that's termed the ALICE household survival budget. So the meat of our report establishes this baseline called the ALICE household survival budget. And it is a localized county by county estimate of the minimal total cost of household essentials. And that includes housing, it includes childcare, food, transportation, healthcare, and a basic smartphone plan, because that's just the technological world we live in now. You know, it does not include any kind of home repairs or travel or laundry or any sort of amenities, extracurricular activities for children or any things like that. And when we think about families who are not even able to meet those minimum standards with regard to childcare, the way they calculated the childcare costs for establishing the basic household budget is to look at the cost of registered home-based childcare for infants and 4-year-olds as those home-based childcare entities are reported to the State Department of Human Services. And we know that a licensed facility would be much more expensive. So when families cannot even meet the ALICE threshold budget of just a registered home-based childcare, that lets you know that some things are off the table for them for a high quality, a regulated, licensed facility that are meeting higher quality standards of care. Sometimes that's a much more expensive alternative that's off the table. So that was a huge finding from our ALICE report.
Well, when this report was generated and apparently all of the United Ways in Mississippi decided that this was something that was good for our state. So that was one thing that you, even though you're autonomous, you all agreed on that you would sponsor or that you would help support that. And then how did you see this working out at the local level? In other words, what would be a plan or some plans that you would see within the counties that you represent and how you would use the ALICE report, or how people that are listening to this conversation could use the report?
Well, we are just about a month out from the full report being released. And we're in the beginning stages of helping to train our nonprofit partners and helping to train nonprofits around the state and educate them on how to use the report in their area. We've been fortunate to do trainings with Mississippi Alliance staff and also with the volunteer hub directors across the state of Mississippi who are in touch with the nonprofit community across the state. So in those initial stages, education is key. I think in just understanding as I said, the depth and breadth of this, when we're looking at 50% of households statewide that are struggling households, there's definitely some things that as a state we can look at to move forward and address this, and certainly on local levels, because the ALICE report allows you to drill down even county by county and even cities within counties to compare data. So for our 8 counties that we serve here in Northeast Mississippi, that's Chickasaw, Etowah, Lee, Monroe, Pontotoc, Prentiss, Tishomingo, and Union. Out of those 8 counties, 4 of our 8 counties are above the state average, which is 50%. So 4 of those 8 are above the state average for ALICE households. Another 4 out of the 8 are above the state average for poverty level. So we know we're at 19% poverty. We've got 4 that are above that threshold for poverty level. And 5 out of our 8 counties are above the state average for household incomes that can't afford even a basic survival budget. So just to put some numbers on that, an ALICE household survival budget, if you are 2 adults and 2 school-age children, let's say in Chickasaw County, you need to make at least $50,400 a year to meet the ALICE survival budget. And we know this report has also done a great job in looking at the economic landscape. The most common occupation in the state is cashier. And on average, that pays $9.21 an hour. So with 2 adults working in the home at a comparable job, you're not going to reach the $50,000 threshold to meet this minimal survival budget. We were really appreciative of a family here in Tupelo that is actually the cover family for the state ALICE report. She was so kind, her family, to share her story with us and allow us to share their story with the state and be the cover of the ALICE report. But the Seawright family is very typical of our ALICE families. They have 2 young children. They are both working, and at one time they've had 4 jobs between the 2 adults in the family, and are still, as ALICE families often are, one flat tire or one car breakdown away from slipping into poverty level or blowing your entire budget for an entire month. So when we put that in terms of daycares, the impact is seen across so many areas of society. I mean, one we know is how lifetime earnings are increased for every year of school that you complete. In recent years, the report talks about 50% of Mississippi children ages 3 and 4 were not enrolled in preschool. So we know that children beginning in kindergarten may be at a disadvantage from the very beginning without increased time and intervention. That can set them up to a perpetual struggle to meet benchmarks in reading and math and other things. And another example, our report showed that 83% of single parent head of households are ALICE households. 83% of single parent households, female households, are ALICE. That is an enormous statistic. And women, we know, are juggling work, they're juggling childcare, and jobs that are not very flexible sometimes. Those are hourly employees, sometimes the low-paying jobs on the low end of salary. As I mentioned, the most common occupation being cashier. And unreliable childcare or even unaffordable childcare is so detrimental to the parent and the child. When it is reliable and is affordable, it's not only going to enable the parent to work and not take time off from work, to work all the hours that they can, but it also greatly impacts their ability to pursue higher education or increased training opportunities that would advance their career or open up new job prospects to that family and move them into a better economic bracket and lift them from the ALICE threshold and from poverty.
Well, it sounds like that this is a great resource that hopefully a lot of communities will take to heart. Community development, economic development, people that would be in some community development positions, as well as Mississippi Economic Council and others that would see the connection between strong wage as well as early care and education affordability so that the workers can stay on the job. I know here in Tupelo, where you and I both live, there's been some unfortunate closures of restaurants and reduction of services at some of the fast food service areas because of the fact they couldn't find employees, or people got sick and they couldn't find replacements. And so it has affected the local community's economic, I'm sure, budget, as well as created some of these businesses to actually close. And that's certainly not what we want to happen. But again, your report that you just talked to us about really makes the case that everything is interrelated.
Absolutely. Absolutely. Keeping our workforce, keeping people in the workforce and giving them those opportunities to move up, and increase their household budget. Childcare is just key for that. The report mentioned that in 2019, 50% of people surveyed out of 322, I believe, 50% of those reported missing work in the previous 3-month period due to childcare issues. 41% of those who were enrolled in a secondary, post-secondary education or a training program had to postpone that because of childcare issues, and 11% left a job altogether because of inadequate childcare.
Those are some sobering numbers, and give us pause, as it should give us pause as a state, not just as a group of people who are always interested in early care and education. And that's why it's so important that I think the United Way has stepped up, because you're not part of the usual suspects, as they say, that can shine a light on how important early care and education is on so many levels. So we thank you so much for being with us today, and we look forward to getting that ALICE report out to as many folks as we know how to do. And if there's anything that you would like to come back and talk to us about in a couple of months after you've done some trainings, then just let us know and we can have another conversation.
Well, thank you so much, Dr. Grace, and thank you for being a part of the Research Advisory Committee for our Mississippi ALICE report. You spent a lifetime and a career of advocating and working for parents and families in the state, and we sure appreciate your interest and expertise and advice in this. And just I would love to encourage a takeaway from this is we're so fortunate in the Tupelo-Lee County area to have an early childhood coalition, and to have someone working day in and day out, a couple of folks in those child care centers and helping prepare these children for kindergarten. It's just such an important piece of work that we'd love to see replicated far and wide. So we appreciate the opportunity to highlight the ALICE report, and then how that can challenge folks to see how that can be incorporated in your communities.
Well, thank you again, and hopefully we'll visit in a few months one more time. Thank you, Patti.
Thanks so much, Dr. Grace. Have a great day.